thought I know what was going on by now. Is it on? I think it's on. Yes, hello. I'm live. Facebook Live. I have done this before. I know what I'm doing. I know exactly what I'm doing. I'm answering some questions and it's 7 o'clock. So what's the problem? Why acting so surprised? Okay. I'm live. The microphone's working, I believe. I have reason to believe the microphone is working. I have reason to believe that everything is going as expected. So it's Tuesday night. That means it is Tuesday, isn't it? Yeah, it is. So it's 7 o'clock, which means we're going to do this thing right now and here. This is happening. You better believe it. We've got some questions. I say I've got some questions which I will address. But as ever, I'd be very welcome for any input on a live basis, either on these questions or of something that of your choice in relation to plastic surgery, preferably. That is my forte. So let's dive right in, shall we? We've got question number one. Changing to B-Lite implants. Right. So tricky case. This patient who has got has had implants, and I think she had. This isn't a patient of mine. She's a patient who's inquired because she's not found much information about B-Lite implants, and I think it's probably the blog. I did a blog post about them, and I think that's where she found me. And she says she's not finding much information about B-Lite implants, and she's had implants in the past, and is now having new implants, and is thinking of having B-Lite implants, and just sort of general inquiry. So there's a couple of things about this inquiry. I could talk a bit about this. Number one thing is she's saying she can't find much information about B-Lite implants or many people that offer it. And I think talking to my colleagues, I think I know why that is. And I think that's because we're all a bit risk averse. There are when it comes to sort of early adopters, the people who buy the Apple, iPod before anyone else and stuff like that, the early adopters and, well, surgeons in general don't go particularly plastic. Well, maybe not particularly plastic surgeons, but I think we're all a bit risk averse. I think basically is the thing, and I think Melissa Versace. Oh, what name is that? That's probably just your Facebook name, isn't it? That's not, but that is a great name, even if it's just even if it's just a Facebook name. Melissa Versace, hello to you. Hello, right back at you. On-screen update of that. How's that going? Is that showing? Should be a smiley face. No. Oh, anyway. Don't know how this works, to be quite honest with you. Grin. Anyway, maybe it is showing. I have to look back. Anyway, good to have you on board, Melissa. And we're talking today about B-Lite implants and So basically, this patient is asking me about them, and I think the reason that you can't find much about them is because you'll find within plastic surgery, most of us are risk averse. There's a couple of early adopters who will adopt things and try things, and the rest of us will sit back and wait to see if they work and to see if there's any complications, any problems, things like that. Now, obviously, they've been tested. They're safe to use. There's no problem with using them, so it's not like something terrible is going to happen. But I think the problem with medicine and particularly implants, and when you're putting devices in, you do worry about the longevity of it and whether problems are going to come later on. And I think that's why a lot of plastic surgeons are risk averse. I do talk to people about B-Lite implants, but I don't really push them. It's not really something that I'm trying to promote or anything like that. It's just something that I tell people they exist, because I think it's important that people know that stuff exists. And so I tell people they exist, and the concept is sound. They're lighter than normal implants. Elizabeth, hi, right back at you. And liposuction revision. Well, that's awesome, Elizabeth, because I'm going to talk about that next. That's my next question. I don't think it was your question, but it might be related to your question. So I'll talk in general about that, and you can always chip in if it's not relevant to you what I talk about. But But yeah, nice live question. That's what I'm talking about, folks. If you want to see how it's done, look at Elizabeth and look at that. Karen, that's how it's done. I had an amazing result, mate. That's by me, everyone. Just so you know, Karen's not just saying that in general. She had an amazing result. That's all thanks to yours truly. So, yeah, thanks, Karen, for chipping in. I wish I could like that or do something to it. Put these grinning faces up. Maybe they are going up. Anyway, I'm just going to leave that up there for a while. Soak it in. So, yeah. So, talking about B-Lite implants and yeah, so that's what it is. And I think there's, when it comes to actually putting implants in, you'll find them, any plastic surgeon who can put implants in can put B-Lite implants in. I don't think there's anything that you need to sort of, there's no sort of training, or there's no who put that up there? Big up Jonathan, big up yourself, big up myself. Yeah, big me up. There's no extra. The technique is the same, and it's just a question of whether the implants are the right thing to do. I've got a few concerns with the patient who's actually asked the question, because what's happened with her, she says she's had radiotherapy, I think, for another reason, and she's had implants in, and she's had them out because of pain, and was thinking of B-Lite implants because she is because they're lighter, and is now reading my stuff, is thinking about polyurethane implants because nobody knows too much about B-Lite implants. That's the question. So it's a bit of a worry that radiotherapy is a bad thing. It's a good thing for treating cancer, but it is a bad thing for the tissues. It causes scarring in the tissues, and it does cause problems. So radiotherapy can be something that causes pain and what have you. And so if you've had implants in and they've been painful, I would worry that putting more implants in will be painful, whether they're B-Lite implants, whether they're polyurethane implants. I would worry that if you've had problems with pain with implants in, it might be that there's some scar tissue there. The scar tissues interact with the implant. I don't know what's going on. I don't know this. I don't know your case, but it just in general, it worries me a bit. And I'm not, Melissa, I want to marry you. Who do you want to marry, Melissa? Who? Me? I'm married. I like your name, Melissa, but I'm married. So, just saying, I don't know if that's me talking to someone else, but yeah. Ooh, things got a bit heated there. Didn't expect that on a 7 o'clock on a Tuesday night. Ooh, right. So yeah, so I'd be a bit worried about this B-Lite implant thing. I think if you're looking for very big implants, I think B-Lite implants have got a place because they're lighter. Average size implants may be less of a place because they're sort of 30% lighter than the standard. So whether they're beneficial as you get to the smaller sizes, maybe they are, maybe they're not. But the main worry, I think, certainly for myself and for most plastic surgeons, not most, don't want to talk about other plastic surgeons, but this might be why you're not finding much information about them. I think we're worried about adopting them. In 10 years' time, we might all be using them, and they might be the standard. That might well be the case. But at the moment, I think anything new, I think you'll find most doctors and most surgeons will be implanting stuff that right. Thank you, Melissa. If you're talking to me, thank you. Well, I assume you are talking to me, but most people will be adopting stuff that has been around for many years, and most of the implants that we use have been around for many years. And I've had this problem actually. You said that your something about the hospital couldn't get the implants. So I've had this problem myself, that the hospital, I've said to patients, oh yeah, I'll do them, no problem at all. But then the hospital will say, oh, it's not on our list of implants or something. They're not an approved whatever supplier. I will talk to them. I'm at the BARPS meeting next month, and I'll see them there. And I'll talk to them about that. Because often when you talk to the manufacturers, you talk to B-Lite, they say, oh, they are on the list, and someone in the hospital doesn't know they're on the list. because I think I've spoken to them about it before actually, and they said, yeah, we're on the list for all the hospitals. But anyway, I'll talk to them about that. But I've had that experience myself, that the hospitals sometimes say they won't stock them or whatever. So B-Lite implants, that's why not many people, it's not that they are not promoting them or whatever. I think we're just worried about them because they're new. Oh my Lord, what's going on with these comments? Because they are so new. I have to put my beard back on. It's gone a bit crazy with the beard. It's because of the beard. But that's the thing with B-Lite implants. Right. So should we do the next question? Let's get on, shall we? We got look at all these comments. I like your Jonathan is an amazing surgeon. I'm just going to read this out for the listeners at home. And fantastic results. I wouldn't have gone to anyone else. Karen, checks in the post. Thank you for that. Because Ange is saying, so that kind of thing. Hello, Jonathan, by the way. Hello, Ange. Hello, everyone. Look at this. It's busy in here tonight. Goodness me. And Melissa's going off on one. Look at that, Melissa. God, dear, oh, Lord. I like your eyes. Right, anyway, let's get on with the questions. Without further ado, because this is... Oh, did that... It's the camera sort of focus. Anyway. Right, this is a patient. Right, here we go. It's this patient, again, not my patient. Not guilty, Your Honour. I had liposuction. Oh, no, this is the question. If you had... Oh, Melissa. Melissa, thank you for that question. That is a question. Mainly the questions really, if they're about plastic surgery related topics, as I say, that's really where I am strong. I'm not strong. So your question, you want to marry me? You want to married me? No, Melissa, actually, I'm married. I'm happily married and I've got children. So I'm spoken for, but thank you very much for the question. Oh my God, Angie's starting on. Yeah, I think it is wrong. Yeah, thanks, Ange. So anyway, don't have any fights, people. So we've got a question here about liposuction. So this patient, this is a person who's asked me, sorry, I've got to read it from over here, so I'm not ignoring you. If you had liposuction and skin removal and waited as expected for 6 to 9 months to see the results, and after things settled, you felt the immediate improvements you saw straight away after surgery were not so good after things had settled, and the bulge you thought was fluid swelling actually never went away and some baggy skin was still a problem, would it be right to expect revision? That's a bit of a... Got to be careful answering that question because obviously this is a person who's like, it's all like saying, oh, I'd like sort of like I'm asking for a friend sort of thing, but I'm assuming it's that patient. Hi Shirley, good to see you. Long time no see. Nice to see you. So this is a I've got to be careful answering this question because I've got to just talk in general terms. So the main thing I would say to you, if you've had surgery and you're not happy with the results, always, the surgeon, go back to the surgeon, original surgeon, and go with them and go with their advice. And I think most surgeons you'll find will want you to be happy, and most will do. We want to do revisions if we're going to have a happy patient. That's certainly the view that most of us got, certainly the view I've got. You want to have a happy patient. You do not want to have an unhappy patient. And there we go. Elizabeth is getting in with an appropriate question for this question. Elizabeth, that's ideal. That is fantastic. So the advice is usually go back to your original surgeon. I think most of us do want to have a happy patient. We do rely on word of mouth, and having an unhappy patient is really quite damaging. And so certainly my view is that, even if the revision is going to be marginal, you'll try and make the happy patient and do the revision. So interesting, this question, the way it's written, because what she said is that the immediate improvements you saw straight away were not so good after things settled. That suggests to me that maybe there is still some swelling going on there. Because if you saw immediate improvement straight away, when you have liposuction and things like that, you often wear pressure garments and things like that to start off with. And you can sort of, you know, when you do this sort of surgery, this liposuction, most surgery really, you can see the result when you're on the operating table. You can see whether the patient's going to get a good result and what they look like, you know, with the liposuction or what have you. By the time you've gone back to the ward, you're pretty much done. You're pretty much swollen, and you don't really know what your result's going to be. So it takes a while for that swelling to go down. So if you immediately saw some results with your pressure garment on, maybe, then that might suggest that that sort of fat has gone, and the fact that you've got this swelling that they're saying has never went away, it could still be swelling, because 6 to 9 months is a long time after surgery. But really, the longer you wait, the better. And sometimes you have to wait 12 months. You know, I normally say minimum 3 months for a revision, but that's something that's really obvious, because you don't want to have a patient that's unhappy for a long, long time. Ideally 6 to 12 months, and ideally a year really, for a revision. So I'm thinking that you want to, I don't know what you've had here, this patient, because she said she's had liposuction and skin removal. Not sure what that is, and saying she's still got some baggy skin's a problem. Would it be right to expect a revision? So I think in general terms, I think it's not unreasonable to wait longer, especially if you saw good results early on, and now it's you know, the swelling hasn't subsided. I think, you know, the longer you wait, the better. Talk to your surgeon, go with your surgeon. I think you'll find most surgeons are trying to give you good advice. They're not trying to get out of doing surgery, or not trying to get out of doing revisions. I mean, I don't want to talk for other people and what other people are like, but, you know, I think most people, yeah, not even surgeons, most people are trying to do a good job. You know, same in if you're a, you know, painter decorator or a, you know, car mechanic. I think most people are trying to do a good job. They're not trying to do a bad job. They're not trying to mess people up and not help them. They will help them if they can. And I think, you know, that's certainly true of me and most, you know, my practice. And I think most surgeons are trying to get good results. And if they're trying to make you wait, it might not be that they're dodging you or, you know, saying they won't do a revision. It might not be. It might be that it's not in your best interest, because if it's going to settle on its own, then clearly that's going to be better. Hey Dawn, big up yourself. How you doing? Good to see you here. The other thing you've got to be a little bit careful is sometimes they have revision policies and timings. You know, you've got to be careful if it's like a year revision. You know, you don't want to wait till 13 months and they say, oh, you could have had a revision within a year. So I just put that in there. But I think, yeah, I think it's difficult to tell you whether it's right to expect a revision. The criteria for a revision is usually the outcome is not to the surgeon's expectations. So that's why as surgeons, we've got to make sure our expectations are aligned with patients' expectations, because, you know, if it's not to the patient's expectation, but it is to the surgeon's expectation, that's where frictions come. And, you know, that's where the revision thing can be a bit, but if it's clearly not right, you know, and then I think most surgeons would be reasonable about it. But I think it's good to wait for as long as possible. And, you know, if you saw good results early on, it's worth waiting. Elizabeth is asking a spin on that. Is it possible to get lipo done twice in the same area? I had it done 2014 and I have a very uneven tummy now. Did you have an uneven? Well, in answer to your question, Elizabeth, yes, you can have it done twice in the same area. No problem at all. Many times as you want in the same area. Absolutely no problem at all. That's fine. I don't know if it's an uneven tummy now. Was it an uneven tummy right after the liposuction? Because that is one of the risks of liposuction, that it can be uneven. So that is a, you know, contour irregularities is a problem following liposuction. And to be honest with you, it's a difficult problem to treat, because it's you know, you try and make things even when you do liposuction. You try and sort of feather it to crisscross, because your cannula is just one thing. So if it's going in one area and it takes out too much fat from that area, you can get a dent. And if you get dents and contour irregularities, they usually settle. But obviously yours is yours is 4 years now. So you're yeah, not immediately, but quite noticeable now. So obviously, as I say, you often get some irregularities, but if it's 4 years, then you're thinking that's not going to be swelling and things. That's, that may well be you. In my tummy, in my hands and in my experience, tummy liposuction is the tummy is not a good place for liposuction. If a lot of people come and say they want tummy liposuction, we get that a lot. But in my experience, in my hands, tummy is not a good area for liposuction. The hips, the flanks, the outer thighs, the male chest, there are some good areas which is good for liposuction. The tummy is not one of them. And the reason for the tummy not being one of them is because the skin isn't as thick as other areas. Hi, Junie. I don't know what's going on. I'm rising above it. So the tummy is because the skin's a bit thin, then you can get the skin doesn't recoil as well as in other areas, and you can get redundant skin. And with tummy tucks, with liposuction anyway, you can get irregularities. So it is a problem. It's a difficult problem to treat with an irregularity because you've either got to do more liposuction and sort of suck the mountains to help them to meet the valleys, or do things like fat grafting into the valleys. Or if you've got a skin problem, if you have got too much skin, the best way to recontour the tummy is a tummy tuck. That is the best way to recontour the tummy. You might not be a candidate for a tummy tuck. It might, because a tummy tuck's a big op, and you might be thinking, crikey, I'm not having that, which is fine. But, the best way to recontour the tummy is a tummy tuck. And in my experience, the other things are not as good. The liposuction and all the there's lots of non-surgical things you can do for for the tummy. Non-surgical liposculpture, the cool sculpting, the Vanquish, the what are they called? There's a few. I can't remember. Anyway, there's all these non-surgical things. They'll come to me anyway now, but there's loads of them. Cooling and lasering and radio frequency and all sorts of stuff. But as I say, the results are variable. Tummy tuck gets good results, but it's a big op. It's a big investment. It's a big investment of time, of money, of your body and things. So that is Elizabeth segued into the other one, 2 liposuction revision questions. Liposuction sounds good, doesn't it? Obviously, I'll win the lottery, I'll have liposuction. You've got to be careful with liposuction. And look at this, Junie, straight in. Boom, straight in with a question about the fat freezing. Does fat freezing work? Oh, well, under, what is it? Don't want to do perjury or whatever. Perjury, is that right? Anyway, you know what, Junie? I don't know, Junie, because I've got my own place. I've got a lovely clinic. It's a lovely facility, and it really is the sort of place that would benefit from a non-surgical treatments like the fat freezing and all the other things, all the other ways of dissolving and destroying fat without doing surgery. And I would love to do that sort of stuff at the clinic because there's no scars, there's sort of minimal downtime, there's less complications because you're not actually doing a surgical procedure. And I love the thought of it. And whenever I go to these meetings, I go and look at these reps and I go and look at these stands, and they show me these photos of people and they tell me how much money you can make by doing all this stuff. But I'm not convinced, Junie. I'm not convinced. The problem is the photos they show you are often the same photos, these stock photos of some guy in America. And like, why are you always showing me the same photos? Or they show you cartoon graphics of fat dissolving and stuff. I don't know. I don't do it. So I can't really comment on whether it works or not because I don't do it. And I might just see a self-selected group of people who have had, who have not had success with it, who are then coming to see me. There might be loads of people out there who are really happy with it. It's certainly a big industry. It's certainly popular. But that's what's been holding me back from taking it on at the clinic. I'm not sure how predictable, I really am all about getting happy patients, and I want to predictably get, everyone really want every single patient to be happy. And if that means not giving them a procedure, or at least maybe that won't make them happy, but at least I won't have made them sad by doing a procedure. Either be happy or not, just not sad. Sometimes I'll not do a surgery or not offer a procedure to someone, and they might be sad about that, but that might be better than actually doing a procedure and then not being happy about it, which is my worry with the fat freezing, because it's not cheap. That's the problem with it. It's not cheap. It's not cheap. If it was cheap, then I think people might accept it a bit more. But at the moment, it's quite expensive, and I think therefore people have an expectation about it. And it's managing the expectation. So what I would say, if you're thinking of it, find someone who does it. Look for before and after photos, and look for results of some of their cases, and try and get a reasonable expectation. And my colleague at Air Aesthetics, Claire Oliver in Henley and Arden, I think she's got the core sculpting machine. So I normally say to people, look, go and talk to her, and hope, she'll give you a realistic expectation of what can be achieved by it. But it's a big industry, so I can't believe it totally doesn't work. Can there be a big industry, like multi-million, I don't know what industry, huge industry on stuff that totally doesn't work? So I'm assuming it must work a bit. The question is how much. But it's really, so I don't do it. But it's a big question, that, Junie. You got me started on that one. What's going on? We got all sorts going on in this chat thing. Goodness me. What is going on? Dawn is saying, been chatting to a friend about my options. She's considering reduction. Do you always do a lift, or does it depend on size? Always do a lift, Dawn. Always do a lift. A lift, because a lot of people say, I want a reduction, but I also need a lift. A lift is always part of a reduction. The thing about the breast is when the breasts are when you need a reduction, your breasts are sitting low. They're too big. I just thought of a case out recently, but anyway, we're not going to cloud the waters. So yes, always do a lift, and that is part of a breast reduction, is doing a lift and reducing the volume. So a lift and a reduction are the same operation, and a reduction just makes them smaller. A lift keeps them the same size, but a lift is always part of a breast reduction. God, look at this. What's going? Oh, where are you from? I'm from. I was born in London, Melissa. I was born in London, and I was brought up in Cornwall. My father's Italian, my mother's Scottish, and I live in Birmingham now. So that's my history there in a nutshell. God, that's me there. So yeah, no, thank you, Dawn. Thank you. So yeah. Blimey, O'Reilly. Right. Right. We've got another question. Another preordained question here. We've got a patient who has inquired. I don't know if you're out there, because don't think we can get a hold of you. I think we got the wrong email address or something. Melissa, you're Italian. Buonasera. I think you have a story. Natalie, good to see you. Good to see you. So what we got here is we've got a patient. Yeah, she's inquired. I think she's given us the wrong email or something, so we can't get hold of her. So I don't know if she's going to watch this or not, because we can't get hold of her. But anyway, I'll answer the question anyway for the viewers at home. She's 72, and she's saying, is she too old for a tummy tuck? I can't remember how she put it. Yeah, she's fit and healthy. Is it a barrier to surgery? No, it's not a barrier to surgery. It is absolutely fine to have a tummy tuck at 72. Not common, I would say. Good to see you, Natalie. It is not common to have a tummy tuck at 72, but perfectly fine to have it done. And the quest. Good evening, Melissa. Nice to see you. The thing about this, and to answer these, I say it's usually breast reduction, really, that we have these older clientele. I think people have spent all their lives working, and then they sort of retire and think, goodness me, I wish I'd done this years ago, type thing. But basically the age thing and surgery is thanks, Natalie. Talking to each other. The age thing and surgery there's in surgery you have what's called absolute contraindications and relative contraindications. So an absolute contraindication would be a scar that's sort of precluding the blood supply, or someone who's, well, there's not many absolute contraindications really. Someone who's got significant health problems, or something that would mean that they totally couldn't have the surgery. So most things are sort of relative contraindications. So I would say it's a relative contraindication. What that means is that we would talk to you and say, look, the fact that you're 72 means obviously you're going to have less time to enjoy the results of the surgery. It is a big operation, a tummy tuck, and you'd have to accept that it's a big operation. It's going to knock you back. There's a big scar. It's going to be swollen. It's going to be tight. There's risks of wound healing problems. There's risks of clots in your legs that can fly up into your lungs. DVTs, PEs, all sorts of risks and complications associated with the surgery. And the question is whether the benefit you're going to get from the surgery outweighs the risks. And in terms of health problems, an anesthetic at that age is absolutely fine. So, and if you're worried, we can always get you talking to the anaesthetist. And really, age has become less, within reason, less of a contraindication than it used to be. Age used to be in the mix, but nowadays age isn't in the mix. And if you're fit and healthy and you can walk upstairs and you can go out and about and you do your, oh my God, oh my Lord, if you're fit and healthy, that's the main thing. If you're 35 and you're not fit and healthy, and you've got lots of medical problems, then you might not be a candidate for a tummy tuck. Whereas if you're 72 and you're fit and healthy, then you might be a candidate. So age in itself isn't a contraindication. It depends on your ability, how you feel, and also how much you're going to benefit from the surgery, whether it's worth it. And that's something for you to decide. You've got to weigh up the risks and the benefits, and that depends. Yeah, for you, Natalie. But I've got to watch my front door. You've got to weigh out the benefit in your own mind. And I say this, we're talking about tummy tuck, but it's for any surgery. Often comes with breast reconstruction. Should I have a breast reconstruction because I'm, 72 or whatever? And it's like, well, again, it's a big operation, but if you're going to benefit from it, then why not? But as long as you realize it's a big op, it's going to knock you back. There's going to be wounds. There's potential for complications. There's potential for problems. And you might think, actually, you know what? Forget it. I can't. I don't want to. So it's totally up to the patient. Jackie's in at the last. Good to see you, Jackie. Nice to see you here. It's all going on here, Jackie. Where you been? Because you've missed it. There's a lot going on. I think you can just check out what's going on down there. So it is not a problem to have a tummy tuck at 72, but we would have to talk to you about the pros and the cons to see whether it's right for you, because that's what it's all about, whether it's right for you, no matter what your age is. It's more about your health and about how, whether it's worth taking it on at this time, and how much of a problem your tummy is. And if it's a big problem and it's really upsetting you, and, then you can take on the potential risks, then you can have it. If it's not a big problem, then maybe you might think, it's not worth the risks. So, yeah. Whew. Amazing results, Natalie. That's what we want. Thank you. I tell you what, I am going to have a lie down now, because I don't know about you, but that was good, really good, very good. Thank you for the hi Claire, nice to see you. It's been a roller coaster here tonight. Oh my God, is this for real? I wonder if Melissa Versace, are you one of my school friends or someone who's decided to come on and yeah, I don't know. Are you a real person, or is it? Anyway, whatever. Thanks for coming anyway, and thanks for commenting, because it's nice. Because you know what this is all about? You know what it's all about? Commenting and sharing. And certainly you've done that, Melissa. You have certainly done that. It's made. It's made, Jackie. Thank you. It's made. What, the cold shower? So, right. Yes, cold shower for me. Feet up, cup of tea, and I suggest you do likewise. And thank you all for being here. That's been a very good session, and I'm very grateful. You're 37 from Rome. Okay, so you're not an old school friend of mine. Okay, so you are. It's a real thing, is it? Okay, that's fine. Just okay. So good to know. Right. Well, there you go, Jackie. Informative. and comedy as well at the same time. I'm glad to hear that, Jackie. So I'm going to check out. That's all I'm going to say. I'm checking out of here, and I've it's been emotional. Oh, I'm on holiday next week. So I'm not going to be here next week. So I know it's upsetting, but you'll be all right, guys. You'll be all right. So I'm actually on holiday the week after as well, but I'm not away. Back next week. I shouldn't say that I'm away because people come and rob the house. We're here the whole time. I'm on holiday, but we're here the whole time. So I don't know the week after. I don't know, but definitely the week after that, I'll be back on. I'll do the posts saying I'm doing Facebook Live and ask a question and stuff. So bless you, Shirley. Excuse me, and bless you all. Thank you for having me. I should have said that. And that's been good. And Shona, the last, where you been, Shona? Where you been? What time do you call this? Going to Italy on holiday. Going to Rome on holiday. Yeah. So yeah, no, I'm not going. No, I'll go to Italy on holiday. So see you next week, same time. No, Natalie, no, I'm not here next week. I'm on holiday. Refer to the earlier bit. Right, beautiful, good one. Got to go now, Melissa. Lovely to. Thanks for coming, Melissa. And I am gonna. Yeah, Melissa, thumbs up to that. I'm gonna check out here. Sorry, don't worry, Shona. Don't be sorry. I'm only joking. It's nice to have you here. Right. Oh, God, let's just stay all night here, couldn't we? Right, okay, so good. I'm gonna, if that's okay, I'm gonna bring. Oh my God, I'm gonna. Thanks for coming, everybody, and I'm gonna check out now because that's been really, really good. Lovely questions there. I'm going to big up Dawn, and I'm going to big up Elizabeth as well for some wicked question, and Junie. Let's not forget Junie with the fret freezing. Shona, I'm going to see you in a couple of weeks' time too. And thank you, Melissa. Thank you for the tonight's entertainment. And I'm going to end it. I'm going to end it now, Melissa. I'm ending it. All right then. Good night. Bye.